Hello everyone, myself Keerthiga, M.Sc Nursing, Nursing Tutor, E.S College of Nursing, B. Now the topic is tonsillitis. Introduction. Tonsils are two small masses of tissue at the side of the throat. Its function is to defend the body against the toxic substances that are found in the blood. Tonsillitis is a painful disease that is caused by an inflamed tonsil. The inflammation is due to infection or because they are filled with foreign substance. Most attack of tonsillitis is occur in person between the age of 10 to 40. When tonsils are infected, they will look swollen, red and tender. A grayish white or yellowish coating may cover part or all of the tonsils. The surrounding area of the throat near the tonsils also may appear red and inflamed. There may be swelling at the side of the neck as the lymph nodes. It grows larger while producing cells to fight the infections. Next, we move on to the definition. Tonsillitis is an inflammation of the tonsil in the upper part of the throat. It can be acute or chronic. Acute tonsillitis typically has a rapid onset. Symptoms may include sore throat, fever, enlargement of the tonsil, trouble swallowing, and enlargement lymph node around the neck. Move on to the causes. Tonsillitis is most often caused by common viruses, but bacterial infections also can be the causes. The most common bacterium causing tonsillitis is Streptococcus pyogenes group A Streptococcus. This bacterium that causes a strep throat. Other strain of strep and other bacteria also may cause tonsillitis. Viral tonsillitis and bacterial tonsillitis. On viral tonsillitis, viruses like those that causes the common cold and the flu. It will cause up to 70% of tonsillitis cases. Commonly, people with viral tonsillitis have milder symptoms than those with bacterial tonsillitis. On bacterial tonsillitis is a strep throat. Bacteria like group Streptococcus causes other causes of tonsillitis. A common name for bacterial tonsillitis is strep throat. People without tonsil can still get strep throat. The virus and bacteria that causes a tonsillitis are highly contagious. They are passed along by kissing or sharing utensils, foods or drinks, coming into close contact with someone who was sick, touching a contaminated surface and then touching your nose or mouth, inhaling air, tiny particles that become airborne when a sick person sneezes or cough. Move on to the risk factors. You have an increased risk of getting tonsillitis if you are between the age of 5 and 15. Tonsillitis is most common in children and adolescents, exposed to germs frequently. Those who work or go to school in buildings with lot of other people have a higher risk of encountering the germs that causes a tonsillitis. Teachers who work closely with children is one of the example. White, yellow or grey coating or your tonsils. Fever above 100.4 degree Fahrenheit, 38 degrees Celsius, swollen lymph node, gland on the sides of your neck below your ears, stomachache or vomiting. It's more common in younger children. Now we move on to the pathophysiology. Due to etiological factor, virus or bacteria enter inside your body through the nose or throat. Inflammatory response will occur inflammations and infections. It may lead to red and swollen tonsils, and it may lead to clinical manifestations. Clinical manifestations: sore throat. A sore throat that lasts longer than 48 hours. Painful swallowing. It's a difficult or pain when you're swallowing. Swollen tonsils. The swollen tonsils is a color is red swollen tonsils that may have a white or yellow coating it present. Fever. A high temperature of over 100.4 degree Fahrenheit, 38 degrees Celsius. Swollen lymph node. It should be a tender enlarged lymph node in the neck. Ear rash. Pain in the ear. Headache. It's a pain in the head. Should be having a bad breath. That is terminology is halitosis. A bad breath. Voice changes. A hoarse, scratchy or muffled voice is present. Stomach ache. Pain or discomfort in the stomach. Neck pain. Pain or stiffness in the neck. Next we move on to the diagnostic evaluations. History collection, physical examinations, throat swab, complete blood cell count. On pharmacological management, antibiotic is needed. One time the injections are in pills that you will swallow for several days. Feel better within 2 or 3 days. Get less of rest. Drink warm or very cold fluids to help with throat pain. Eat smooth foods such as flavored gelatin, ice cream. Use a cool mist vaporize or humidifier in the room. Gargle with warm and salt water. In nursing management, should be a complete rest. Then adequate fluids. Pain management. Lozenges, salt water gargle, humidifier, avoid a irritant, comforting a food and beverages, and then hygienic measure. Surgical management. Tonsillectomy. It is a removal of tonsil. Tonsillectomy is used a very common treatment. It's an outpatient procedure. It's usually lasts less than an hour. Recovery usually takes 7 to 10 days. May have some pain in throat, ears, jaw or neck after the surgery. Get plenty of rest and drink lot of fluid while recovering. On preventions, wash your hands is often, not sharing a food, drink utensils or personal items like toothbrushes with everyone. Staying away from someone who has a sore throat or tonsillitis. So move on to the complications. Peritonsillar abscesses, middle ear infections, and next breathing problem or breathing that stops and starts while sleeping, obstructive sleep apnea. Tonsillar cellulitis or infections that spread and deeply penetrate nearby tissues. Thank you.